All right, Savannah, thanks so much. And now to your health in the year ahead. The country, well, really the world as a whole, looking to hopefully end the pandemic and start the recovery in 2021. NBC's medical correspondent, Dr. John Torres, joins us with the 3 things we need to know. Dr. Torres, first of all, good morning and Happy New Year to you.
Good morning and Happy New Year, Hoda.
Okay, so the good news at the end of 2020 was we got the vaccine. And now the big question for 2021 is going to be, when do you think most Americans will have received the vaccine?
Hoda, I think most Americans will have received the vaccine by come late springtime, early summertime, and that's where you're going to see a big turn in the pandemic. As bad as 2020 was for most of us, I think 2021 is going to be a fantastic year. That we're going to start off working through the pandemic, getting it under control, but we're going to end up celebrating.
Well, hopefully, and that will come, as you said, late in the year. But do you think before that time we will get to see a little bit of normalcy? Will people be able to eat dinner together or go to like small gatherings together?
I definitely think we will. And a lot of this is going to be contingent on how many people get the vaccine and how fast they get it. And we know vaccines are rolling out very, very quickly. More to come over the next few weeks and months. But getting it into people's arms, that's going to be the important point. And the sooner we can do that, the sooner we can get back to that sense of normalcy. But it's going to be a slow roll. And so I think you can start looking springtime, summertime, people being able to get together with those, expand their bubble to a certain extent, and more things opening up, more sporting events, more concerts, more of those types of things. By the end of the year, I think you're going to see us back to fairly normal, maybe not completely, but fairly close to normal.
Now, if we fast forward to the end of 2021, December, do you think during that year we will have been wearing masks for most of the year, or do you think we'll be rid of them before the end?
Hoda, I don't know if we're ever really going to truly get rid of masks, because I think that's going to be part of the new normal, is looking at the way masks are used in other countries, where in particular in Asian countries, where if they have cold and flu season and people start getting sick, I think our new normal might be, hey, let's go ahead and start wearing masks. That way we can keep things under control, because the truth is coronavirus is not going to go away, but with vaccines, we're going to keep it under control. There might be pop-ups, flurries every now and then of coronavirus cases, and in cases like that, we might need to go back to the mask. But for the most part, I think summertime, we're going to start seeing people not having to wear masks, being able to get together with family and friends and do those things that we've all been missing over the last year.
Yeah, our second lesson is, as we've been focusing on the coronavirus, there's been a lot of stuff we haven't been focusing on. A lot of people aren't getting the tests that they should be getting, their checkups, their screenings, and all that stuff. What have we learned there?
And that's a huge concern. If you heard a few months ago, cancer cases were down, which in any normal year, that would be fantastic. In this year, though, that's not good news, because that simply means that people aren't getting screened for cancers and they're getting seen later. And once you see them later, they're harder to treat and they can cause more issues. And that's not just cancer, that's health overall. And because of COVID, because either systems being shut down, hospitals being taking care of COVID patients, clinics not being open, people weren't able to get the health care, or once they even started opening up, people being worried about going in and getting COVID and not getting their health care needs met. And that's just adults. For children in particular, big concerns about their immunizations. And are we going to have measles outbreaks this coming year? That is a distinct possibility. So there's going to be a big push in the next few months going into 2021 to get people to get these things they need to get children to catch up on their shots.
The other thing, Dr. Torres, that struck me, and I know there are mental health issues with all of us, but specifically for those nurses and doctors, I see them, they haven't come up for air, and I wondered about their mental health and if it will be cared for. Is that something they should be tackling in 2021?
I think that's definitely something they should be tackling in 2021, because I know, talking to a lot of my compatriots, they're saying, we have been working overtime for the past 6, 7, 8 months, and that's going to continue on to the next couple of months. And then you hear about people not wanting to take the vaccine, or people not believing COVID is a true disease, and that causes even more issues. And so I think once this gets under control, there's going to have to be some mechanism in place to take care of their mental health, because this could affect them for the rest of their life. And we have to remember that we're not out of the woods yet. We're getting there, but the sooner we can get that taken care of as well, I think the sooner we can get them back to normal, the workforce back to doing what it needs to do, and everybody back to where we want to be.
And finally, Dr. Torres, you're optimistic about 2021. Is that how you feel?
I'm extremely optimistic about 2021. And like I said, I think we're going to start off still controlling the pandemic, but I think we're going to end celebrating as much as we weren't able to get with family and friends these holidays, this last holiday season. I think we're going to double up on that this coming holiday season and just have huge celebrations across the country. And I see that happening very much by the summer, but definitely by the end of the year.
From your lips to God's ears. Dr. Torres, thank you.